Right, let's get more from the BBC's South Asia editor, Anbarasan Ethirajan. Thank you for joining us. We heard there in Alana's report that the true scale isn't something we know right now. Why is it so hard to get a realistic picture of what's going on in India?
And many health experts would point out that the best way to contain the virus is test, trace, and treat. And these three things should be done. But if you look at the number of tests being conducted in India at the moment, we are talking about around 200,000 tests per day. And so far, they have done about 10 million tests. But that is nothing compared to the size of the country and the population. We are talking about 1.3 billion people. So it is basically only about 4,000 tests per million, whereas the world average is nearly 30,000. So testing is a big issue because when you look at this, how this pandemic started in India, the number of tests were very, very low. Now they have increased it. That's why you are seeing more and more cases are coming out. But the challenge for the authorities is what is happening in the rural areas of this country, because many people would hesitate to, go to any hospital saying that, I have coronavirus, because there is a stigma attached to it. Many people would ostracize them, telling them not to come out of the house, that they fear that they might be taken to some of these quarantine centers where they will be kept for 14 days. So what the experts are pointing out is like what is happening in India at the moment is only tip of the iceberg. And the peak period is yet to come in India, probably end of July or even August or September.
And Anbarasan, briefly, you referenced there the scale of India. Presumably we're seeing some states doing better than others and some local decisions being better than others as well.
Yeah, for example, if you take a state like Kerala in the south, they have only 26 deaths and about 5,000 infection. Whereas if you see the neighboring state of Tamil Nadu, there are more than 100,000 cases. The difference is Kerala was adopting the very, very stringent policy of testing people, tracing them. As soon as they reached the state, they were able to trace those contacts and give them the treatment. Whereas in Tamil Nadu state, for example, they relaxed the lockdown, and then people are going to the markets, fish markets and vegetable markets, and then it started again. That's why they had to reimpose lockdown. So any particular situation doesn't apply to one particular part of India. However, what the authorities are facing, the challenge is that convincing the people that you should come and test so that we can give you the proper treatment.
Anbarasan Ethirajan, thanks for bringing us up to date on that story.